Hi, I'm Dan Smith of DPS Legal Counsel. Welcome to today's video. Today is Tuesday, April the 23rd, and the reason I'm mentioning the date is because I wanted to talk today about an announcement that was made yesterday and which was talked about in this morning's Wall Street Journal about how HHS and CMS have put out an announcement that there will be, beginning January 1 of 2020, a testing of new payment models for physicians in primary care practices. And the goal of these new payment models under Medicare is to provide for value-based payment to physicians and other providers rather than straight fee for service. The goal is to hopefully produce healthier patients across the board and to provide maybe more equitable and more certain payments to providers, and also to put some emphasis on providing value to patients rather than having the focus on providing fees for services. And the goals are healthier patients, hopefully by the risk sharing between the government and the physicians to have lower cost health care. And that's basically it. There are 5 payment models that were announced. 2 of them deal with primary care first, or PCF models. There are 2 of those, and then there are 3 direct contracting payment models. As we learn more and more about them, I'm sure there will be a lot of talk in the news about these 5 payment models, which will be put in place. And we'll see how it goes. Something has to be done to improve our healthcare system. It's in need of help, and a lot of physicians and other providers are moving away from governmental pay models just because the reimbursement rates are so low. There's no certainty of payments, and doctors and other professionals like nurse practitioners are looking to directly contract with their patients through either concierge practice models or direct pay models where the patients pay on a monthly basis for their care through the clinic. And a lot of doctors may be moving away from even taking, not only not taking Medicare and opting out of Medicare, but also moving away from commercial health insurance to directly work with their patients on getting paid. You see this a lot in functional medicine practices, where the focus is more on spending greater time with patients and looking at the patient holistically, working for the wellness of the patient on a more systemic and holistic nature. And by doing that, it's difficult to practice in a successful practice if you're relying on low reimbursement rates, where the fact that you spend maybe an hour with a patient rather than 10 minutes, you're going to get the same amount of money for the service. And so these new payment models that have been published and put out by HHS and CMS, which will go into effect January 1, is a response to the clear problem that exists in healthcare right now. We'll see how this goes. We'll be digging into these models and how they work more as the days progress, but I did want to get this notice out to you today just to let you know that this announcement had been made yesterday by HHS and CMS. And if you go to today's Wall Street Journal, today is April the 23rd. There is an article in the paper today about this announcement. All right, that's it for today. I hope this helps, and like I said, we'll be following up in detail about the proposal from HHS and CMS in the coming days. Thanks.